Please stand by, everyone. We'll get started in just a couple of minutes.
Hi, Frangie. I think my video is now working.
Hi, Dr. Shaw. It looks like we can both see and hear you. Thanks so much. All right, well, it looks like we're ready to get started. Good afternoon and welcome to the Wednesday, April 7th, COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Sheann Allen, COVID-19 Vaccine Director, Dr. Scott Lindquist, Acting State Health Officer, Lacey Fehrenbach, Deputy Secretary for the COVID-19 Response, and Dan Laster, Director of the Vaccine Action Command and Coordination System Center. To begin today's briefing, we'll open with remarks from Secretary Shah.
Great. Thank you, Frangie. Can you hear me okay?
We can. Go ahead.
Great. Well, good afternoon. Thank you to our media partners for joining us this week. And I want to also add thank you to both Sheann and Lacey for joining me this afternoon. We also have Dr. Lindquist on and Dan Laster on as well for additional questions. We know there are a lot of different issues and challenges, and also fantastic progress that we've made that we want to highlight today. But let me first start by saying that this commemorates National Public Health Week. And so I wanted to start off by just recognizing National Public Health Week. And the theme this year, as you know, is building bridges to the future. And if we ever thought that this was a moment that public health was not just about what we've been doing over the last decades, but also about what we're going to be doing in the future. But this time in COVID-19 and fighting this pandemic shows the absolute importance of public health and the need to invest in public health. And so let me just also just say thank you to all the people across the public health system in and across Washington for everything that you have been doing. That means at Department of Health, that means in all the various associations and various groups, that means local health partners across jurisdictions, across this great state of ours. What you do each and every day, what you have been doing each and every day and night, what you have been doing each and every day and night and holidays and weekends is just a testament to the incredible work and the incredible dedication and passion by which you are always responding on behalf of communities. And so I would ask our media partners to really champion, if you haven't already this week, the importance of National Public Health Week and the importance of public health, the importance of investing in public health, and the importance of public health, as this year's theme shows, building bridges to the future. We know this has been a very difficult time for all of us, and we know that this is really an opportunity for us to remind ourselves of the importance of the work that all of us are engaged in. Yesterday, Governor Inslee and I joined the first gentleman of the United States, Doug Emhoff, and Congressman Kim Schreier, and the Yakima Health District, and other key partners in Yakima at the FEMA vaccination site. And I want to just say that it was just an incredible experience. And if you've seen the images or saw what occurred yesterday, we had Washingtonians coming together, working together to make sure we were doing everything we can to serve community members by getting vaccinated. And I think it's really important for us to be thinking about opportunities such as the FEMA mass vaccination site, as well as the 4 mass vaccination sites that we are operating at Department of Health in support and coordination with our partners on the ground, of just how important the work is and it continues to be. Just about an hour ago, I was at Snohomish County at a mass vaccination site. And I will tell you that I met somebody named Jaime who was getting his first vaccine. And he had his 2 daughters in the car, and he took a picture with me, so you can see it on Twitter in a bit. And I will tell you that, Jaime reminded me of the importance of the work that we do, and also reminded me of the fact that he was part of the Hispanic community. And he wanted to make sure the message was clear to everybody that we want to fight misinformation with good information. And we want to fight this pandemic with every tool that we have in our toolbox. And that includes masks, that includes watching our distance and washing our hands and getting tested when appropriate, right? If you've been exposed or you are with symptoms, but it also includes the promise of vaccines. And we want to make sure that we're doing everything we can to make the opportunity for vaccines throughout the state of Washington available to all when eligible. And we are very excited about the fact that next week, April 15th, we will have all Washingtonians 16 and above be eligible for vaccines. But I will tell you one thing that Jaime reminded me was that while we're doing all of the work behind the scenes to increase our supplies from the federal government, doing all the logistics and the administration piece, that it also ultimately is about vaccine demand and communicating the message of vaccine confidence. And that is something the second gentleman yesterday mentioned. That is something that the governor yesterday underscored, is that we have 3 vaccines that work. We have 3 vaccines that are effective. We have 3 vaccines that are safe. And we want to make sure we're doing everything we can to fight any misinformation and provide the right information so people are getting vaccinated. The governor and I and our teams met yesterday also with members of the Latinx community in the Yakima area and beyond. And we heard a lot of great insights and feedback, and we learned about things that were working well. We also learned about some challenges that continue to be in the spectrum. One I just mentioned around communication. we also recognize the absolute incredible work that's happening on the ground with our partners. One of the things that we heard from loud and clear was the importance of having evening hours and non-traditional hours for vaccine clinics. And we have been working behind the scenes. I've directed our team at our mass vaccination sites also to assure that we are having evening hours that are beyond the 6 p.m. hour, at least a couple of nights a week. And we hope to be able to launch that as early as Monday of this coming week. I also want to make mention that the other piece that was very much a part of the discussion was our community members telling us that they wanted to make sure that there were linguistically and culturally appropriate messaging that was there for their communities. And coming from a community myself, I recognize that having English language is one thing, but to have the language materials translated and available in additional languages, but also to have people available that can handle phone calls in different languages, and also make sure that all of our materials, including on our website, that is about vaccine appointments, is also in additional languages, is absolutely critical to the work that we do. We are seeing concerning increases in disease activity in the state of Washington. I think it is really important for us to keep this in mind, that this pandemic continues and case counts are increasing in many places, including 4 of the 5 largest counties that we have. The sharpest increases, as I mentioned last week, are in people ages, the younger people, and it's particular in ages 10s and 20s, the teens to 20s, all the way into the 30s and 40s. We know that these are populations that are also least likely to be vaccinated. Hospital admissions are flattening, but in many ways, we're also seeing many age groups increases, and that is of concern to us. Dr. Lindquist is on, and you can talk about those trends. We know that while we have made incredible progress in our vaccine efforts, in fact, one milestone that Shannon is going to talk about is that 20% of Washingtonians are fully vaccinated. That still reminds us that 80% of Washingtonians, though, are not, and they're still susceptible. So why do I bring this up? I bring this up because ultimately, we know people are still experiencing COVID fatigue, that we want to be out of this pandemic, but none of us want to see a 4th wave. Our behavior matters. We cannot let our guard down. We know that all those preventive measures, as I mentioned earlier, are absolutely critical. We also know that vaccine is a crucial tool, but vaccine is not our only tool. It is not enough by itself. We must use complementary and effective measures for prevention to make sure we're doing everything we can to continue to protect Washingtonians. We're now approaching 4 million doses given in the state of Washington. As you know, our goal previously was 45,000 vaccines a day, several days. Recently, we've reached 80,000 doses per day. Looking across people age 18 and above, over 40% in Washington have at least 1 dose. And this is from the Centers for Disease Control Prevention, the CDC. Over 40% of Washington have had at least 1 dose. And this is people aged 18 and above. And as we approach our full eligibility for those 16 and above on April 15, we want to remind everybody, don't hesitate, vaccinate. Key message, don't hesitate, vaccinate. We're at a tipping point and everything we do matters. As you know, there was an article in the Atlantic that called this the tornado phase, that communities with high vaccination rates, low risk, won't see it, but others will be devastated and can be devastated. We want to make sure we're doing everything we can, that people are wearing masks in public, that we're still avoiding gatherings unless we absolutely have to, that we're avoiding unnecessary travel, that we're doing things behind the scenes to protect those around us. And that means championing messages, that means washing our hands, that means, again, wearing those masks. And that ultimately also means that if you can help someone in your community get vaccinated, please do so. The gentleman I mentioned, Jaime, he made a comment to me, which he said, while I was waiting to get my own vaccine, I was doing everything I can to get others around my community understanding the importance of vaccinations. And I think that is a critical piece, that even if you do not have access right now because of eligibility or because of some other reason to get vaccine, you can encourage others to get vaccinated. That especially includes our seniors. And as you remember, we had talked about last week having over 300,000 seniors that are not vaccinated yet. And we want to make sure we're doing everything we can to help them. So we have our phone number, 1-800-525-0127, 1-800-525-0127. We have our Department of Health website. We have websites across the system with our local health jurisdictions. There is no reason that that people in our communities do not have access to information, and they do not have access to where they can get vaccines, especially our seniors. We want to make sure that that is something that we are encouraging all of you, our community members, to help us, is to get the information out to seniors. Again, the reminder that National Public Health Week really highlights ways that we have built bridges recently. Public-private partnerships, for example, through the Vac Center. We've had around actually close to 50 partners, and Dan Laster can talk about that as well. We're gathering feedback from almost 20,000 people during vaccine planning. We're continuing to engage communities most impacted through our Vaccine Implementation Collaborative, and I'll be on that collaborative later on this afternoon with Sheann and others. And we're going to be really, again, getting feedback from our communities, because we know it's not just about numbers, it's also about equity. Equity is front and center, and that's equity across racial and ethnic diversity. It's also about geographic diversity. It's also around language and cultural diversity. And we want to make sure everybody recognizes the absolute importance of the work that is being done across the state of Washington. We've also invested in 41 community-rooted organizations for outreach since September of this past year, and ongoing work with our healthcare system, our local health partners, and really many other partners that are community-based partners across the system is why we are continuing to have success across the state of Washington. Let me close by one other fact that I wanted to make mention of, is that throughout this pandemic, we've been asking for assistance from our federal partners, and we've been doing everything we can to continue to make known that we need partnership. And one thing that has been really exciting is that FEMA, the Federal Emergency Management Agency, has shared with us that they are with support from both the Department of Health and our local partners, including in Yakima, that they're actually going to be working with us to schedule, and we've already scheduled 1,900 vaccinations across 20 community pop-up clinics. Some of those schedules have already been done, but by April 10th, we're going to have these community pop-up clinics like in farms and churches and community organizations. The reason I bring this example up is that this is a partnership that was exemplified yesterday, federal, state, and local, and community working together with our private sector to do everything we can to vaccinate Washingtonians. So I want to thank you. This is National Public Health Week. We're building bridges. We're doing a lot for the future. But right now, we're also very much focused on the present. And what that means is it's not just the 4 months that we've been doing everything we can to protect those most vulnerable and most impacted by COVID-19 by vaccinating. It's also the next 4 months of all the different activities that we are going to be doing so we can continue to vaccinate Washingtonians. So with that, I want to thank all of you. I want to thank our team that's on this media briefing. And I also want to thank our partners on the ground during National Public Health Week, everything that they are doing and they will continue to do. So ultimately, we can protect Washington, not just from this terrible pandemic, but for all other public health issues that continue to afflict our communities. And with that, Frangie, I will turn it back to you.
Thank you, Secretary Shaw. Next, we'll go to our COVID-19 vaccine director, Sheann Allen.
Great. Thank you, Secretary Shaw, and thank you, Frangie. I'm Sheann Allen, COVID-19 vaccine director for the department, and I'm filling in for Michelle Roberts while she's taking some much deserved time off this week. So first, I want to share some of the great vaccine numbers we're seeing across our state. I do have some graphics to go along with them. And so there they are. So as of April 3rd, more than 3.7 million doses of COVID-19 vaccine have been given out in Washington. We've administered 83% of the roughly 4.4 million doses delivered to our enrolled providers, including long-term care facilities, hospitals, local health jurisdictions, tribal nations, federally qualified health centers, and pharmacies. Next slide, please. We consistently surpass our goal in vaccinating nearly 60,000 people on average every single day. 60,000. That's a huge and something that all Washingtonians should really be proud of. Dr. Shaw also highlighted that we've hit 80,000 doses administered multiple times over the course of 7 days, which is another huge accomplishment. Next slide, please. And finally, our 4 state-led mass vaccination sites continue to do amazing work. They're on track to administer their 200,000th dose today. And so again, those are the 4 state-led mass vaccination sites and 200,000 doses, and we'll be hitting that milestone today. And on the previous slide, I think I said 60,000, and I just want to emphasize that it is 60,000 doses on average every single day. So moving on to the Pfizer vaccine and its authorization for 16 and 17-year-olds, we know that there are many parents out there that are eager to find vaccination appointments for their teens. Some 16 and 17-year-olds are eligible right now. And then we know starting next Thursday, April 15th, that all 16 and 17-year-olds will be eligible. Currently, Pfizer is the only vaccine type that's authorized for teens that age, which makes searching for vaccine appointments a bit more challenging. We're working hard to update our vaccine locator website to include vaccine type, and we hope to have that available sometime soon. In the meantime, Vaccine Finder, which is a federal tool that is intended to be updated once a day by enrolled providers, that can identify specific types that are available across the state. In addition, we're encouraging our providers to clearly identify the type of vaccine they're offering for available appointments to help alleviate some of the barriers that parents and teens may be experiencing. However, we are hopeful that other vaccines will be available for teens and even children later this year. Last Friday, Johnson & Johnson announced its expanding vaccine trial to include 12 to 17-year-olds, starting with a small group of 16 and 17-year-olds using a stepwise approach. So starting with a small number of adolescents and then really expanding to a larger group. Moderna is also studying the safety and effectiveness of its vaccine on kids. So overall, there's a lot of really potential development, a lot of exciting potential developments that are coming in the near future around vaccines. So finally, let's go over vaccine allotment for this upcoming week. Next week, we expect to receive more than 380,000 doses of vaccine, which is a bit less than what we were hoping for. This includes close to 13,000 doses of Johnson & Johnson, and that's the part that we were hoping for a larger allocation of that specific vaccine presentation. So as many of you know, last week, nearly 15 million doses of Johnson & Johnson vaccine were ruined at a manufacturer plant in Baltimore. Although this is unfortunate, the good news is Johnson & Johnson tells us that they're still on track to meet their commitment or their target of 100 million vaccines available within the United States by the end of May. So our 3-week forecast does show a significant drop in Johnson & Johnson, both this week at 13,000 doses, and then next week dropping down to even 5,000 doses per week. But I really want to remind people that those 3-week forecasts are estimates, and they're sent to us from our federal partners as a planning tool for both local and state level planning. And so we do know that these forecasts, they are subject to change, and typically we do see them change each week. But on the bright side, there is a new funding allocation coming into the state. This allocation goes directly to dialysis clinics, and again, just additional doses making available to Washingtonians. Before I close, I want people to know that we are making amazing progress with our vaccine distribution, and we're vaccinating tens of thousands of people every day. Like Dr. Shah mentioned, the fight's not over, so please continue to wear your mask, wash your hands, watch your distance, and get vaccinated as soon as you can. Together we will vaccinate Washington. Thank you.
Thank you, Director Allen. This brings us to the Q&A segment of today's briefing. We do have several media with questions today, so if we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Jessamine with Q13.
Thank you so much. Appreciate all of your time. And this is a question for both Dr. Shah and Dr. Lindquist. With the rise of the cases of the B.1.1 variant, specifically in the Midwest and the Northeast, spreading among children, what level of concern do you have with so many children returning to school this week? And what are the chances this could accelerate the timeline for younger children under the age of 16 to be vaccinated?
Yeah, thank you, Jessamine, for that question. I think in general, we remain cautious when it comes to the variants related to all age groups, right? This is not just about children. It's not just about seniors and elders. This is about the entire spectrum. We are concerned because we know that variants throughout communities across the country, and certainly we're no different in our state, we worry that that can certainly blunt the progress that we were making when it came to this last surge, the third surge, and bringing the case numbers down. But I use the word blunt because I think that's also where vaccines come in, because we know that can also blunt the impact of those variants. But the issue is when you come to kids, it becomes a little bit more challenging because we know children, unless you're obviously 16 or 17-year-old, will not be eligible for vaccines for some time to come. And so I think that really does make it absolutely critical for all of us as adults to do everything that we can to be one, championing to our kids all the things related to the preventive messages, but also to follow those messages ourselves. When it comes to additional pieces related to kids going back in school in person, we remain steadfast that kids can return to school in person as long as we are doing the things to keep them safe when they're in those schools with all the preventive protocols that are necessary in order to protect them. So I do think it's complex, but at the same time, it really is related to the fact that we are blunting the effect with vaccines. We've got to champion the messages and model the behaviors as adults. And then we have to do everything we can to continue to protect kids as they're in person in schools throughout Washington. Dr. Lindquist, Scott, you want to add to that?
Yeah, just to be really concrete about this, it's a concern. We are not seeing the same concerns that some of our partners are seeing around the country about large numbers of kids being infected with our variants. But again, we're one of those states that's really doing aggressive genotyping on all our positives. And I've asked our group to specifically really pay attention to kids. Let's really do an analysis of all the kids coming through to see what variants and how prevalent it is. And like Dr. Shah says, we're concerned about it. We're cautious about it. We're not seeing these big trends in kids right now in Washington State, but we are all over it, looking for it.
I'd like to add one thing, and Dr. Shah did a great job of covering the safety in the school environment. Schools are very structured places, and our schools are working really hard at helping kids to follow those health and safety measures which are required in Washington State. The other thing we all have to do as parents and caregivers is make sure our kids are using those same protective measures in less structured places like playgrounds, sports, clubs, etc. That will be equally, possibly more impactful in where disease trajectory goes in our state, and in particular for young children.
All right, our next question comes from Nicole with Cairo Radio.
Hello, everyone. Thank you so much for taking my question. With several counties now showing case rates above the threshold, how likely is it that we'll see some of them take a step backward in phases? And how many counties could we potentially see going backwards to phase 2 in the next week?
Well, Nicole, thank you. And we don't want to speculate in advance of, how many and numbers with that. But, obviously this is just a reminder to all of our community members that we're not out of this pandemic. And so everything that we can do even now forward, if you haven't done it before, this is the time to double down on those preventive measures. I'm going to turn it to Lacey in just a moment because I know she's been monitoring this along with our team as well more closely. But I do want to say very, very clearly that we will, unfortunately, or fortunately, depending on how you look at it, have to take the appropriate action when we believe that people may be at risk. And if we feel that because of case rates or because of other metrics that we need to dial back, we will have to do that. And we're also hopeful that we don't have to do that. And so the good news is that we're making progress in communities across the state, but there are communities or counties where we are seeing increases that are of concern. So with that, Lacey, let me turn it to you.
Thanks. So the Healthy Washington Roadmap to Recovery system is set up to provide a dial to allow our economy to be more open and activities to be more accessible to people when disease rates are low, and then to dial them back when disease rates are high. And unfortunately, right now in our state, we're seeing an increase in disease activity. We are also starting to see an uptick even in hospitalizations. Fortunately, we have vaccinated a very large portion of our seniors, so that helps mitigate the effects of the disease increases a bit. However, when we look at our data, there are a handful of counties that are sort of at the threshold or above the threshold for case rates or hospitalizations, and there is a decent likelihood that a handful will potentially be moved back on Monday when we announce.
All right, thank you. We do still have several reporters with questions. Our next reporter is Arielle with the Spokesman.
Great, thank you. My question is, are we starting to see more uptake of the vaccine in Western Washington versus Eastern Washington when we're looking at vaccination rates of those regions as a whole? And is that due to supply or hesitancy?
Arielle, thanks. I'll turn that to Sheann, and maybe Lacey might have a comment as well. We're doing everything from a state level to allocate vaccine on a pro rata basis across counties across the state. It is not a perfect process for a number of reasons, but our goal is to geographically be able to get vaccine based on population pro rata. That said, there are weeks where you'll start to see that there'll be some ups and downs, and it's not a perfect science. It's really trying to balance a number of different considerations. We have made it clear that it is not an exact apple-to-apple match. And I use the apple because we're in Washington. If we were in Texas, I would have used pecans, but an apple-to-apple match. And it's really very important that we do everything we can to try to be as consistent as we can across the board. But on a week-to-week basis, that can be challenging when we have a limited supply. Sheann or Lacey, did you want to add to the specific data question?
Absolutely, thank you. So we continue to work with our partners to make COVID vaccine accessible and convenient to the public in all areas of our state. And we do have some data points where we're seeing that the intent of receiving a vaccine increasing and then the hesitancy decreasing. And so really that gap is increasing. And that's data that was pulled from the Gates Foundation. The most recent numbers did come in February, so we expect to see an updated chart soon. But we're just watching that trend of that hesitancy really being reduced. And we have lots of campaigns that are going on to really address the hesitancy, both on Eastern and Western Washington. And then also, we know that as vaccine supply continues to grow, access will only continue to get better in both Eastern and Western Washington. And then some of the access issues, such as rural locations, they can impact both sides of the state as well. And so, as Dr. Shah mentioned, each week when we're doing the allocation process, definitely pro rata is top of mind, trying to get as much vaccine out into the communities equally as possible, along with looking at the equity and identifying social vulnerability areas that are disproportionately impacted by COVID vaccine. And just to clarify, not COVID vaccine, by COVID disease.
I was going to say by COVID disease. Thanks. Frangie.
All right, thank you. Our next question comes from Steve with Como.
Hi there. Thanks very much for letting me ask the question. Two topics I wanted to ask you about. One is to the deadline on Monday for the possible phase move back. Is there time for counties that might be at or above the thresholds to turn things around within a 5-day time frame? And is there things that counties or people who live in those counties that could be in danger of falling back be doing now to try to help with that process? The other question I had for you on a different topic is, are you seeing what the CDC is saying in terms of an increase in hospitalizations in younger people?
Yeah, let me just start with the second, and maybe Scott, you want to jump in on this one. So, we are seeing hospitalizations increasing in younger populations, but I will tell you that part of that is that we've also had disproportionately previously older populations that were being hospitalized. And we do think that with some of the efforts on seniors and elders and those above 65, that has also helped decrease the number of over 65 that are being hospitalized, which is great news. But then when you start to then compare it to other populations who have not been vaccinated yet, by and large, because they haven't been eligible, then you will have some increases just from a purely mathematical standpoint. But I think your point is a broader one, which is we are concerned about younger people in our communities who may partake in activities, or because they're not yet eligible for vaccines, which obviously will be changing in a week here, that they may be putting themselves at risk. And that's why the message to our entirety of the population is that we are continuing to be in this pandemic, and please help us fight it. Scott, you want to add to that, and then I'll turn it to Lacey.
No, I think you covered it. You covered it well.
Okay.
So for movement next week on Monday, we will use the most recent complete data that the state has, comparable for all counties across the state, in terms of the question of, is it too late? The most important thing I can say to young people and all people is every single choice we make, every single thing we do adds up and matters. And what we do today impacts our disease rates a week from now, 2 weeks from now, 4 weeks from now, 2 months from now, because the chains of transmission, go on. And so if you avoid infecting 1 or 5 people today, that makes a huge difference in the immediate term and the long term. So for counties that are on the bubble, so to speak, and concerned that they might be moved back, that is not the time to let down your guard. That's the time to double down on your efforts, so that if you're moved back, you're quickly moved forward back to phase 3.
All right. Our next question comes from Maher with KXLY.
Hi there. We have a ton of appointments available around Spokane County for vaccines. I'm wondering, why do you think that is? And would this surge be prevented or a little easier to if we opened up vaccines 8 days earlier to adults?
Thanks, Mayor. Just a quick question, just back to you. When you say a ton of appointments, where are you seeing that? Is that in the mass vaccination sites or through our vaccine locator? Where are you seeing the appointments?
It's a few places. We've had several clinics from local providers like Chaz and Providence where appointments aren't being taken. And then specifically that mass vaccination site at the arena. I mean, yesterday we heard from them where the entire slate of appointments all day was essentially open, and they were kind of relying on that 45-minute waiting lot to use some of the doses before getting them back over to Safeway. So we have a lot of viewers seeing those open appointments and wondering why they're open, but they can't get it because they don't qualify yet.
Yeah, that's interesting. The first thing I would say is that we know that we're fast approaching April 15th, which is just a week away. And just a reminder, with the president's announcement yesterday of April 19th to really encourage all states to open up eligibility to 16 and over when it was previously May 1. So, we're a few days ahead of that time frame, if you will. This has been the three-legged stool concept. It's really about vaccine supply. It's about logistics and administration. And ultimately, it's also about vaccine demand. And, I'll turn it to Sheann if she has some additional comments. I'm not aware specifically of anything different that's happening in the Spokane area. But I will say that ultimately, this is why we are concerned about making sure there's strong vaccine confidence. So then when people are eligible, that they are availing themselves of the appointments. The reason we did not want to go sooner, right? Prior, it was May 1, the president put out there, and we went to April 15th. The reason we don't want to go sooner, we want to do everything we can that to open up eligibility to those that are, this is in that sense, the opportunity for those who are at risk or who are in certain types of occupations or have certain comorbidities to be able to get vaccine now before it opens up to everybody 16 and older on the 15th. So I can't specifically tell you why, Maher, in that area that's what's being seen. Maybe Sheann has some additional comments about that. But I will say that we do think that this is the appropriate strategy to continue to move in the direction of making sure that vaccine is available for people across the state of Washington at the right time. Maher, let me turn it to Sheann.
Yes, thank you so much for that information. It's definitely something I will explore. I'll reach out to the Chaz Clinic and to Providence. I do know at our Mass Vac site, yesterday they administered 858 doses. And so that's pretty in line with what's been reported. I know, the day before that, it was at 979, the day before that, 762, the day before that in the 600. So 858 seems about reasonable, but I will definitely look into that and find out, if that is a trend that we're seeing over in the Spokane area.
And Maher, the only other thing I would say is that if you can also encourage people in the Spokane area, if there are appointments that are available, to please go to our website or our partner's website and do everything they can to get those appointments scheduled. So, this is you can help us also get that strong message out to the community that there are appointments available. Again, we'll follow that through, but thanks for bringing it to our attention.
All right. Our next question comes from Alison with Cairo.
Hi there. My question is on allocation. It sounded like before we were really hoping in April we were going to see those allocations go up even as high as 600,000 doses a week or so. How is it looking? You mentioned earlier about this week at 380, but what's the rest of the month look like?
Yeah, I'll turn that to Sheann, but let me just say one quick comment, which is, this is why we've said throughout that this is not going to be a perfect process all the way until we're out of this pandemic. And there are twists and turns, and there are ups and downs. And we know our federal partners doing everything they can to get vaccines to us. We know the vaccine manufacturers doing everything they can to ramp up production and get vaccines out the door. As you know, there were some recent challenges and shortfalls related to the Johnson & Johnson vaccine supply. So this is the continued reminder that we're in a crisis. And if we think this is going to be perfect throughout, there are a lot of projections, and there are a lot of plans that are based on those projections, but you just don't know until the vaccine arrives at the door, essentially, to make sure that the vaccines are in the state of Washington. So I just want to make that comment that we continue to appreciate the support that we've gotten and the information we've gotten from our federal partners. But we're hoping, especially as we have more people that are going to be eligible starting next week, we're hoping that the vaccine supply, if not in April, but at least in May, significantly increases so we can really match that demand of those who are now eligible.
And just to add on to that, so the 3-week forecast, it is a little bit lower than we had hoped for. But like I shared, these are estimates. They do change up until the day we get the ordering caps. And we are hearing from our federal partners that they're still expecting this increase of around 600,000 doses. That would be prime and booster doses arriving into the states. You're right. We're sitting at estimates around just under 400,000 doses to the state allocation. And just a reminder, we also receive about 100,000 doses for the federal retail pharmacy program, about 20,000 doses for the federally qualified health center program. We have the new addition for the dialysis clinics. That amount is unknown at this point since it just started last week. But so on top of the 400,000 doses that we're getting, there are other doses coming into the state. And so really looking, ramping up, communicating out to partners that when we receive that increase, that we'll be ready. Providers are excited to, ramp up and really get their clinics running if the vaccine is there. So I feel like from the state perspective, Washington state perspective, we're ready. We're just waiting for the supply to arrive.
All right. Our next question comes from Evan with the Seattle Times.
Thanks for the time. I'm wondering if the state plans to stick with the pro rata allocation if there's a difference between west side and east side demand. We are hearing of softening demand in places like Yakima, Spokane, as Mayor just discussed. And I'm wondering if that pro rata commitment, how long will that last, and will we reevaluate that?
Thanks, Evan, for that. And, I will, and I'll turn this one over to Lacey as well. I would say that in this stage, if you will, the phase that we're at, we still have a limited vaccine supply. And when you have limited vaccine supply, what you're trying to do is to be as equitable and fair and really allocate across jurisdictions across the entirety of the state. That said, when we're at a different phase, when we have adequate vaccine supply, remember the three-legged stool, the supply isn't as much the shorter leg. It's now logistics and all those other factors. And then the third is the vaccine demand, that if we start to see that vaccine demand is lagging in certain areas and we can't increase whatever we've tried, then we may need to look at additional strategies. I think everything should always be on the table because this pandemic has reminded us of the importance of evolving our response. But right now we don't have plans to pivot away from that, because we do believe that we're still in a very vaccine supply limited phase of where we are. Lacey, did you want to add anything to that?
Just to add, pro rata is a main driver of how we allocate, but there are other factors that we are looking at, including the social vulnerability index. We have not immediately, but thought about in the future, adding in an element of demand potentially. And as the secretary said, nothing is permanent in a pandemic. The whole nature of your response is to be continually evolving and adapting. So, that those things could be options on the table as we go forward. Our goal is to vaccinate as many Washingtonians as quickly and as equitably as possible. So something we're paying a lot of attention to right now is making sure we're not leaving any populations behind. People of color, people with disabilities, certain geographies, people in rural communities, et cetera. We have to pay attention and balance all of those dynamics.
All right, our next question comes from Keith with Como.
And I know that Dr. Lindquist deferred on this question the last time, but I'd still like to get his take on the concern about young people becoming more and more hospitalized and whether there's an urgent call then to get them vaccinated as soon as they're eligible.
Yeah, so as we described earlier, this age group 65 and older, essentially that was initial targets of the vaccine. We're seeing their hospital rates flattening out or even decreasing. So what we're really talking about is this younger age group increasing. And that's also coupled with a few things, Keith. That is a lot more mobility, outbreaks in bars and restaurants, construction industry, homeless shelters, a lot of factors going into this. So yes, indeed, we want to employ the tactics we know that work. So social distancing, wearing a mask. I know this is becoming old hat and it's not very fun, but we know these work against disease. And so for this age group, as good as a vaccine, start to do these social distancing, take them seriously, really wear your mask, really social distance. Do you really need to go on a trip on spring break? All these things should be standard mantra for this age group. Yes, indeed. I do think next week when the vaccine is available, we really need to encourage this age group, which is driving the pandemic in Washington state, to get in line and get vaccinated to shut down transmission. Hopefully that's about as clear as I can be for you on that one.
Hey, Frangie, we've got 5 minutes left. So how are we doing on the queue?
We have one more question if you'd like to take it.
Would love to take it.
All right.
We would not leave the last question behind.
Excellent. Our last question comes from Paige with the Seattle Times.
Thank you for the last question. My question relates to the Yakima mass vaccination site. I've heard from several people now in Seattle who have driven to Yakima for appointments. Some were not eligible, but said that they were able to bypass the questionnaire. So I'm curious what the thoughts are on people who are driving long distances to get to vaccination sites.
Well, Dan, are you still on? Dan Laster?
Yes, I am.
Okay, Dan, I'm gonna say a couple things, and I'm gonna turn that one to you because I think this really gets to first of all, the drive from Seattle to Yakima is beautiful. So I would encourage in other times when it's not about going to get a vaccine, when just the drive, it's incredible scenic beauty. But what the concern is, and what we want to continue to do, is to drive vaccine accessibility to where people are already located. So in other words, what we don't want to do is to make it so difficult for people to get vaccine, they've got to drive hours to get it. That's not what this is about. It is unfortunate when you say, some people have tried to get around, I think that's the word used, to the system. That's unfortunate. But I will tell you that our commitment is to continue to move towards making accessibility and access to vaccine where people, what I always say, live, learn, work, worship, and play in the community where they are. And I think that's a key message for us. Dan, I'll let you answer also, because maybe something related to the vaccine locator and the public-private partnership and the efforts that you've been engaged in.
Sure. Well, just following up on what you, first of all, can you hear me? Yeah. As Dr. Shaw said, we really want to make it as easy as possible for people to, in a convenient way, for all Washingtonians to get vaccinated. And with the new vaccine locator, we really are, I think, making incredible progress. Just in the last week, over 740,000 Washingtonians access the site. And what that really enables Washingtonians to do is just put in their zip code and see the closest location. And what we really do want to encourage is people to look, where is it convenient, make decisions. See, we don't want to be encouraging people to make that drive. As Dr. Shaw says, it's a beautiful drive, but we want people to be vaccinated in as convenient a place and also to stay close to home so that those allocations that were discussed really are for those in those communities. So that allows the local health jurisdictions and the providers to serve those in that part of the state. So I really do encourage, we've just had, since it was launched, over 1.3 million Washingtonians have used the tool, and 70% are clicking through to provider sites. And so we've just had great response, and it's to address this issue. We don't want Washingtonians to feel like they need to drive across the street. And so I'll stop there. So I don't know if that addresses what you were thinking, Dr. Shaw.
Yeah, no, it does. Thanks, Dan, for that. And thanks for your continued work in leading the VAC Center. I know there's been a lot around the country about the public-private partnership that the state of Washington is engaged in. You've been leading it. And so just continue to do the great work, and also kudos to the private partners who've come together with the public sector to be able to execute on this. So thank you so much.
Absolutely. My pleasure. Thank you.
And
with
Dr.
that,
Shaw,
go ahead, Shan.
Just to add on to that, we really encourage people to get vaccine in the county they live or work. And again, if we're traveling, to other counties or other side of the state to get their vaccine, then that's impacting the pro rata that we were talking about. And, really wanting to make sure that the county residents and people that work there have access to the vaccine, and others are getting it where they live and work.
Yeah, one other thing I would just mention, one other reason why you would want to try to stay closer to home is because, we want to make sure that if you do have a vaccine reaction or something that happens, a day later, or when I received my vaccine dose, my wife gave me the acetaminophen and told me to go to bed because I was having some chills that evening, and it was better for me to be close to home rather than driving or doing things in another community. If you want to connect back with the vaccination site, we do want to encourage you to be closer to your residence or your work location. So I just wanted to emphasize that from a medical standpoint. So I hope that answers that question. And Frangie, I just want to, before I turn it back to you, I want to thank Dan and Scott, as well as Lacey and Shan, especially for pinch hitting for Michelle this week. I want to thank all of you for being on. And I want to thank our media partners as well for just continuing to be with us throughout this pandemic and sharing good and impactful, but also accurate information with our communities. And finally, I want to just remind us that we're in National Public Health Week. It's a commemoration of this very difficult time that all of us in public health, but beyond now in communities across the country and the globe, people are recognizing the importance of public health, that we have to really recognize it, we have to support it, we also have to invest in it. I just want to thank everybody for all the hard work on our partners on the ground, everything that you're doing to help us every day achieve the goal of, you see it right behind Shan, vaccinate Washingtonians, and that's so key for all of it. And also to our community members, don't hesitate, vaccinate. We want to make sure that that message is also resonating with everyone. So with that, Frangie, thank you so much, and I will kick it back to you.
Thank you, Secretary Shaw. Well, this concludes today's media availability. I'd like to thank our panelists for their time today, and TBW for hosting today's live stream and archives of past briefings. Thank you all, and take care.